Every single week in the ER, I see patients who waited too long to come in with the wrong symptoms, and it drastically changed their outcome. So, in this video, I'm going to walk you through 10 of the most common symptoms that require an ER visit and what to do if you experience these symptoms. My name is Dr. Ryan, and the goal of this channel is to make sure you and your loved ones stay out of the emergency department. So, let's go ahead and start with the most common visit that I see in the ER, the most common symptom, and that's chest pain. When people hear chest pain, they often think about the hearts or heart attacks. And while this is true, there's actually a lot of other diseases that cause chest pain that require emergency care. Some of those include large blood clots in the lungs, also called pulmonary emboli, a collapsed lung, which is also called a pneumothorax, or even the large blood vessel that comes off the heart can be damaged. And this is sometimes termed an aortic dissection or an aortic aneurysm. And all of these require emergent intervention. Oftentimes, when I see patients with heart attacks, they describe it as a severe substernal chest pressure or squeezing that often radiates to the jaw or the left arm, and it's worse with exertion. It's sometimes associated with nausea and sweating. And if you're at home and you develop these symptoms, I recommend that you immediately take two baby aspirin. I recommend chewing them instead of swallowing them. That's because this will help reduce platelet aggregation and reduce clot formation. Then immediately call 911. Some of the other symptoms, such as a pneumothorax or a collapsed lung, this is common in smokers or younger people who vape or even people with genetic abnormalities. And this symptom often presents with sudden onset sharp chest pain, worse with breathing, and shortness of breath. Blood clots in the lungs are another thing that can cause significant mortality and require emergency care. And oftentimes, these are associated with sudden onset pain as well and significant shortness of breath. So chest pain should never be taken lightly. And if you do develop chest pain, I recommend that you call 911 or go to the emergency department every single time. For number two, we're going to talk about stroke and stroke symptoms. This is probably the most delayed symptom presentation that I see in the emergency department. More often than not, people try to brush these off because they can be very vague and very minimal. So, if you develop any neurological symptoms, start right here, any neurological symptoms, you should call 911 and be seen in the emergency department immediately. But there is a mnemonic that can help you remember these symptoms, and that is B fast. F stands for facial droop. A stands for arm weakness or leg weakness. S stands for speech abnormalities. And T stands for timing because it requires very specific timing. There's a lot of other very subtle neurological symptoms that present with strokes, such as aphasia or difficulty saying what you want to say, or receptive aphasia, meaning you can't understand what's being said to you. And strokes have a very specific timing in which they need to be treated. If it's greater than 4.5 hours, you can't be given a medication that can help break up the clot. If it's greater than 24 hours in very specific scenarios, endovascular nerve surgery may not be able to do anything at that point. Not only are these symptoms associated with strokes or blood clots in the brains, they can also be associated with brain bleeds, which are completely or can be severely devastating, especially if you're on blood thinners. So these need to be treated as early as possible for the best possible outcomes. If you, a loved one, or even a bystander out in public develops any weird neurological symptoms, I recommend calling 911 every single time. Coming in at number three is shortness of breath. This is another symptom that should never be disregarded or delayed, especially true in patients who have asthma or COPD or other breathing abnormalities. Oftentimes, their breathing status can deteriorate rather quickly and often requires immediate intervention. But some other things that it can be is infectious symptoms such as pneumonia or viral illnesses. Can also be pneumothoraxes or large blood clots, as we previously mentioned. But it can also be heart attacks. Heart attacks can come in with shortness of breath. So if you develop shortness of breath that's significant, you need to be seen in the emergency department. Coming in at number four is heavy bleeding. Sometimes this is delayed because it isn't always obvious. If you sustain a wound or trauma or a cut and you can't get it to stop bleeding, or the wound is really big, then it's clear you need to come to the emergency department. But for some people, they don't actually know when they're bleeding. This is true in patients with GI bleeds, especially patients on blood thinners or antiplatelets. So if you begin to notice dark, tarry stool, you're vomiting blood, you start getting lightheaded, you look pale, you feel weak, these are signs that you're having bleeding and you need to be seen in the emergency department. So again, it's not always obvious. Sometimes, somebody gets shot, stabbed, they have large wounds, they're bleeding, they need to be seen. And sometimes it's subtle. So this is something you should always be aware of, especially if you're on active blood thinners. Coming in at number 5 is passing out or fainting, also called syncope. Overwhelmingly, passing out or syncope is caused by a neurocardiogenic syncope, such as when people see blood or they get significantly emotional and pass out. And that's usually not any cause for concern, but it's really hard to differentiate what is actually causing the symptoms without being evaluated. This is especially true in elderly patients, and syncope with other symptoms, such as chest pain, are usually caused by other more severe problems. These can include blood clots in the lungs, aortic stenosis or your aortic valve not working appropriately. It can be a cardiac arrhythmia. It can be blood loss. So while it's overwhelmingly not usually a serious thing, it does require at least evaluation in an emergency department to try to figure out what's going on to rule out all of the other life threatening abnormalities that cause it. Number 6, sudden severe headaches, especially when they start during exertion, such as working out or sexual intercourse. These can be signs of intracranial bleeds, such as ruptured subarachnoid hemorrhages or even hemorrhagic strokes. More often than not, a headache, especially in a healthy person, is not something that's dangerous. But when the headache starts sudden and severe, and then it actually kind of gets a little better, that's a symptom that we should be concerned about. Also, if you develop a headache and any form of neurological symptom at all, including numbness and tingling, difficulty speaking, blurred vision, changes in vision, difficulty ambulating or walking, anything like that needs to be seen in the emergency department immediately. If you have a history of migraines and this is a typical migraine without any changes, then you probably don't need to be seen. You just need to take your migraine medication. And if you're not improving, you probably need to follow up with your primary care provider or your neurologist or whoever you see about your migraines. This isn't about that. This is a very specific subset of headaches that I'm referring to. Number 7, head injury. If you're a patient who takes blood thinners and you have a head injury, you should be seen in the emergency department every single time. If you're a younger person and you have a relatively mild head injury, you don't always need to be seen, but there are some symptoms you should watch out for, especially in your children. And this is things like confusion, not acting appropriately, asking repetitive questions, any neurological symptoms such as weakness of an extremity, not walking appropriately, or recurrent episodes of vomiting or emesis. If you or one of your children gets a head injury and develops these symptoms, you should be seen in the emergency department. But again, I'm going to reiterate, if you take blood thinners and you have a head injury, you should be seen in the emergency department every single time because you're very high risk for bleeding in the brain. Number 8, high fevers, but with other symptoms. A high fever alone is not detrimental. A fever is just your body fighting the disease. It's doing what it's supposed to do. A fever can be uncomfortable, but a fever caused by infection is very rarely ever a cause for concern. But if you or your children or your loved ones has a fever plus confusion or a fever plus difficulty breathing, things like that, then they do require emergency department visit. A fever alone, unless very specific scenarios such as under 60 days of age, immunocompromised, then they often don't need to be seen in the emergency department, especially if they just have basic viral symptoms. You can just treat the fever for comfort and it should improve over the next couple of days. But anything, a fever with any serious symptom should be seen in the emergency department, or a fever and the patient's under 60 days of age, or a fever and the patient is immunocompromised, they should be seen in the emergency department. Number 9 is severe abdominal pain. This is probably one of the most common ER visits that I see in the emergency department. And I'm going to reiterate the severe part, especially if you're younger, because symptoms of abdominal pain can be a wide range of things from anywhere from dyspepsia and GERD to appendicitis to a ruptured colon. So, with that, I want to reiterate the severe component. Oftentimes, I'll see patients come in with nausea, vomiting, diarrhea. They have symptoms of a basic virus. Those patients, as long as you're young and healthy, don't usually need to be seen in the emergency department. But if you develop severe pain, regardless of the location, you should be seen in the emergency department, especially if it's in one of the quadrants or you have a history of any abdominal surgeries. In number 10, this one's a little more subtle, but it's sudden confusion or mental changes. We all know that sometimes as people age, they can develop Alzheimer's and they can relatively quickly progress or have progressive dementia. This isn't about those patients. This is about a patient who you've seen them a couple of minutes ago and they were completely fine, and now they're not. They're acting confused, they're not themselves. This can be a wide range of diseases, including strokes, bleeds, infection, and should always be evaluated in the emergency department. It should never be taken lightly. So I'm going to end with one final message. People who come into the emergency department to see me very rarely regret it. But when they come in too late, they often regret it quite a bit. So it's better to be safe than sorry, especially if it's you, a family member, a loved one. When in doubt, come to the emergency department to be checked out, call 911 or call your primary care provider. We're always there to see you. We're always willing to care for you. Even if we find nothing wrong at all, we're glad you came and we're glad that you got some reassurance.